blood pressure, your blood sugar. They were like, go ahead, go ahead. How are you finding your course? I've had a lot of patients who come tell me like when they're leaving the ward, when they're discharged, I hope you do well. You're a great girl. You're so brave being out here with your family. You're good at what you do. I wish you all the best. And I'm like teary because that's me. That's how I. Hi guys, welcome back to my channel. Today I'm with my friend. I've got another guest for you. My name is Jessica, as you all know, and my friend is.
I'm Wilhelmina, and I'm a second-year nursing student.
Okay, today we'll be talking about placements because I'll be getting a lot of questions about placements, and I've got my friend to share her experience with you. So far, we've had like four placements. Four placements. We're going on the fifth one, like from next week. So we were yet to talk about it. What was your experience with your very first placement?
My first placement was very good. Like, I had a good experience. It was on the neurospinal ward, and it was interesting. I like the staff there because, like, going to a new place of work, you find it like it can be a bit hard. You don't know anyone there. You don't know how they're gonna treat you and stuff like that. But I had a good experience, and everyone was very supportive of me. Like the nurses, they were like asking me if I needed any help and stuff like that. And the manager, she was really nice. Like, she was like the mom, like, to me everywhere.
That's
she
nice.
was a lovely lady. Like, I liked her a lot, and she made my placement go like easier.
Oh, I don't know. It was just mixed. Like, the staffs were really, really, really okay. They were nice. Like, they liked me a lot, but the ward was really hard. It was a surgical ward.
Yeah, okay.
And it was trauma and orthopedics.
What sort of patients like do you have? Like, different patients?
I had like different patients. I had like sweet patients too, but you know that thing of trying to care for someone, and when you try to touch them, they're screaming because they've broken their hip, like a female hip fracture, and they had like that surgery, and it was just really difficult. And the word was kind of heavy for me, knowing that was just my first time in the field. Like, I was really scared at some point. I was just looking, when they teach us in uni and would have practicals, it feels like, oh, this is it.
Yeah, you can do
when
it.
I'm doing that with mannequin. When you get when you get on the ward and you're dealing with the patient, and
it's quite different actually.
You don't know what to do. You're just lost, and when something is happening, you're not involved in it because you don't know what to do, or they're asking you questions. They're asking you a question and you don't know what to answer. It's really, really difficult. But that was my first placement. That was my first experience. I met like really nice staff, and then I didn't have a permanent job. Guess what? The workers there. Yeah. They spoke to the manager to sign me up for my job. Yes.
Did I think that offer?
Like, they offered me. They were like, go and be my. I was like, no, I will. And I was leaving, and I was sitting down. The manager came to me and told me, Jessica, I heard you've been taking your time to tell me to sign you off. No, you've been really good on this. Like, you're really good and we'll sign you off. I am not scary. It's just a uniform. And I was like, okay. And she signed me up, and I'm happy. So I go back there for shifts. I pick up shifts there. They were really nice to me, but just like my own experience was that the word was really heavy because that was my first time going on to placement and everything. And I had a second placement. Woo!
Which was?
Woo!
Hitchcock was it?
That was on a stroke ward. So imagine going for trauma and orthopedics to a stroke ward. I felt like
baby heavy actually.
I felt like it was karma for me because it was really hard.
Was it not like, because you said the first one would be like heavy as well, so what's the difference between the first one and the...
This heavier.
Okay.
The second one was heavier, but I learned a lot of skills. Yeah. That was really good. Like, because I had patients with NG2 and everything, had to give them medication and everything. I learned like a lot. Even on my first placement, I had like nurses who come tell me like, come and mix the IV, and I was like, no. They're like, you can do it. Put your mind to it. You can do it. Don't be scared. Mix it. I'm here with you. Go through the BNF if you need to know what to mix. And I was like, okay. You just need that push from somebody, and when you have people who support you, it's really like cool and everything. And I was like, okay, that was it. Second placement cool and everything going on well. What about placement hours?
So we need to do 40 hours per week. So that's like 3 days. yeah, depending on like where you work. If you do like 9 to 5, then you're gonna maybe do
More
5 days.
days, make
Yeah,
up
more
your-
days. Yeah,
to make up your hours.
more than that. And you do have 2.5 hours for like reflection, so we can do that in our own time. So like yeah.
So for the placement hours, it's just like 12 hours long shifts.
Yeah.
12 hours long, free hours. Free, they're free. So when we get, like, my first placement was 6 weeks, second 6, third 6, fourth placement was 7 weeks. So in that 6 weeks, you have to do 4 days a week in between before you get through to make up your hours.
Oh,
So you do 3
all
hours,
that.
3 hours, 3 hours, but before you get done, you have to do 4 hours within one of those
because
weeks
we
to
didn't
make up
include
your
it, right?
to make up your hours. Yes, that was what I need. That was what we needed to do. And 12 hours.
Yeah, from 7 to 7:30.
7 a.m.
Yeah, in
to
7-hour break.
7:30 and 1 hour break. And if you do night shift, so it's like 7 p.m. to 7:30 the next
Yeah.
morning, unpaid hours.
But it's a good experience.
It's a
I'd
good
say, especially
experience.
to practice what you've learned in uni, like put in
Yeah,
practice and stuff.
because a lot of things I've learned today was from placements.
Mm.
Like I had learned a lot of things. I just felt like, okay, I know what I'm doing. Imagine
Yeah.
my last placement. I'm able to admit patients, discharge them, explain the procedure they've had done, like give them what's it called? Was it post-op? After that's post now, like after surgery. Post-op advice and everything. And I felt like, so one day I was giving somebody, and she's a doctor. I didn't know she was a doctor, and I was explaining. I was like, when my sister told me you spoke to a doctor and she said she's proud of you, I was like, okay. And we've also got dress code, funny shoes. Very funny shoes. They don't let you wear Crocs, but sometimes.
I mean, it depends where you go. Some of them are very cool. Like you can wear black trainers, you can wear that, but it depends where you go.
Yes, but because you have like this shoe from Clark's that I got, really horrible shoe, but I think it's just good in case something spill on your shoe or needle or something, like, so you don't get injured and everything. Your uniform, your hair must be packed up. No nails. No, just full stop, like just one little dot of earring. And no, what's it called?
No lashes.
Most places don't let you wear lashes. A lot of places, like depends on where you go to. That's another thing. But like for the real code, dress code, you don't need like lashes. So in case you're assisting a patient with feeding, it doesn't drop into the patient's food and everything. But I think it's good. And what else do I say about placements?
The placement I had was in HCOM. That is like caring for all the people. It's really busy. Like it is so hard. Like, and it was always understaffed. So obviously I was like counted in the staff. I was like one of the staff. It's not supposed to be like that, but and I had a time where I had to do meds round on my own. Like I was very nervous, but then the staff were very like helpful. They came in to check on me if I'm doing the right thing and stuff like that. But I got the experience though, so it was a bit. Well, I was excited because I'm gonna be doing that when I qualify anyways. But yeah.
So for me, when it comes to meds, so they let me do it from my first year, so my very first placement. So at some point I was like, okay, it was cool. Like I could like do it even when they changed from the paper to like stuff. So my third placement, this place you're going to write right now, I did meds all through. My second placement, I can't count how many times I did meds because I was just caring for patients.
Wow.
So like they see you when you're in first year, they're like, oh no, they just treat you like somebody told me. Do you know what somebody told me? The overhyped HCA. That's what they called me one time. Like, oh, they just want you to do the basic like patient care, helping with assisting with personal care, feeding and that and toilet like that. So that's what you just needed you to do. But that my third placement, I did medication all through. I felt like I was involved.
Yeah.
Like like that's what we needed. You get because the basics of telling you, oh, shower, go help the patient with shower, do this, do that. We've done that.
Yeah,
and
first day,
even when we go on our jobs, we do that too. So, but when it gets to the part of that's what you want us to do all the time because you think that we're not qualified or we're not like. But we came here for you to teach us. You've taught us this part. Teach us about the medication, and because that's really what we need to even learn. You get. So I did that, and It's
did you
cool.
go to any inside visit, like
I
exciting
did
one?
a lot of inside visits. My first inside visit was witnessing a surgery where they had to do the fix the patient's hip,
Yeah.
a broken one. Second one was skin grafting. That was on a bone,
I've
like
seen that too.
like-
That's quite interesting.
like yes. And I saw even someone like had to cut the patient's finger off because of infection. Then I had a lot of interesting ones, like on my last placement, because it was in theater.
Yeah.
So I saw a lot for gynae patients, trauma and orthopedics patients. I also saw what's it called, HPV. I think I saw a lot in this place, because they had it's a surgical ward.
Yeah.
Like they just do surgeries there, day surgeries. You just come in for surgery, go back home to get. So I saw like different procedures and everything. But it's really cool, like conquer that fear. Before I was like, oh, I can't see blood, but now.
Yeah.
So you get used to it over time, and even though you feel some type of way, because you're a human being, but
Yeah, in my first place when I went to see a brain surgery, like I just went with my patient. That was really cool. Like I seeing how they putting using the drill to pull the hole, the skull. It was really interesting. I don't know how they did it, but they have to obviously mark where they're gonna put the hole in and stuff like that, and then they're gonna take the extra fluids in the brain and all that. It was really interesting. But then after 5 hours, the patient was already awake, talking to me in the bed. I was like, how is this possible?
Yeah, it
was interesting to see.
It just feels like, so that's the same thing I had with my first placement, my first ever time going in for surgeries with the patients. When he told me I needed to go in for, and I said I wasn't going.
Why?
I was scared. Like, what if something goes wrong? How am I going to cope? I can't sleep alone at night, knowing that something happens to somebody. They were like, you need to go in. You must go in, if not, I won't sign you off. And we also need assessors to sign us off from placement, because that's you need that. So if you have to beg everybody, or just do the best behavior, that's why you have to. Even if you think you're not being treated well, you have to be on your best behavior just to get signed. Of course, that's a really big thing. Without that, I don't think you'll get your pin. You can't get the hours. You can't get your hours, and you can't get your pin. So you need that for NMC to sign you off. Do you know that when I went in for surgery, I was looking at the surgeon. She made it look like she was just gisting with some patient. Everything was just going. I was like, what kind of brain does this woman have? And I like people like that. But I just felt like, so I'm going to be like this someday, even if I'm not going to be a surgeon. But I felt like being able to. So that time I just had a reflection, this patient's life is in this lady's hands right now. So if she goes through, anything goes wrong, it's on you. And I saw how the lady carried that on with surgery, and I was like, this lady is someone like me. How many heads does she have? I can do this, she can do this, I can do it. That's what I was telling myself. But it just went on where 2 hours later, the patient was okay. We went back to the ward, and she was okay. 2 days after, physios came, and
it's just interesting to see what
interesting to see. People have had bad experiences, people have had nice experiences, but it's just what I tell myself is, it's 6 weeks, and when I'm done in 6 weeks, I'm done. I'm not coming back here again. But I've not really had places that I do and say I will not go back. I've had one, but I'm not going to say I've had one, but I don't even pick up shifts there, because the kind of job I do, I'm able to pick up shifts on any ward I want to, and it's really good because it helps me to see different places. And I've been to AICU before, adult intensive care.
That was
woo! When I went in for handover, the staffs were over 50, and I was like, what's happening here? Am I in ED? Then when I went in on the ward, I just saw different things. I've not seen it before.
That's why it's good to go
that's why I like that I have to pick up shifts everywhere. And I was really scared when I went in. Imagine I was like, now, and I was just like, okay, it's just different things, and you see a whole lot of things differently. And how do you feel about how patient treats you sometimes?
I was I went on this board on a shift thing to do a short day. one of the patients, she was very like racist. Like she was like, I want a qualified person, I want a qualified professional. I don't want like people of that color and stuff like that. She was horrible to everyone, but I didn't let it get to me because she's in pain. She must be stressed. She's been in the hospital like for a long time. So I just it's fine. I help her anyway. So yeah, I think just don't like let it get to you. Just like I don't know, block it out of your mind and stuff like that. Yeah.
Truthfully, at first. It got to me when I came, like at first, like you want to help somebody and they're hitting you, calling you black monkey, get out, and over time I'm just like, okay, it's fine.
You understand?
I'm in days, and there are some that will treat you, if you just do this, oh thank you my darling, if you do this one, thank you my sweetheart, like before you get, I've had the patient like, I was checking his blood pressure. Thank you. You're a darling. You're a star. I did this for him. Oh, can you get me the cup? I gave it. Oh, thank you. I like you know. So those kind of people, like, so because of those kind of people, I don't I don't even think about something else. I've had a patient who didn't let me do anything for her, and it was on a night shift. She didn't let me touch her. She was pressed, and I was going to take her to the toilet. She didn't tell me. Waited for the nurse to come back to the bay. So she peed, and I was like, why is she not sleeping? She was awake the whole night. Because she didn't want me to help her, and I felt like, okay,
there's nothing you can do.
No, you can, but you can't force them. Like you can't force them. And some will tell you, oh, you're not qualified, and I don't think you can. You can't touch me. You can't check my blood pressure. Do you know what you're doing? And there are some who want you to do like, oh hi, my name is Jess. I'm a nursing student. Is it okay if I check your blood pressure, your blood sugar? They were like, go ahead. How you finding your course? I've had a lot of patients who come tell me like when they're leaving the ward, when they're discharged, I hope you do well. You're a great girl. You're so brave being out here with your family. You're good at what you do. I wish you all the best. And I'm like tearing because that's me. That's all I've done. That's who I am. Like if you compliment me, I cry. If you tell me about something bad, I cry and everything. But that's really nice, and that's for placements. Do you have anything else about placement?
Not really.
We'll still have more placements, so maybe with time, like we get more things to talk about. Because now we're going to start doing lots. When we start taking charge, we'll have to get our own patients now because then we're more involved in things. And over time, care planning very important. And that's this for this video. Thank you guys for coming through, for always being here. Thanks for watching. Please don't forget to subscribe to my YouTube channel.
Subscribe and share. Thanks.